Madam Chair, council members, and participants, we are now live.
Thank you. I'm sorry, one moment, please. Good morning and thank you. This is the Committee on Public Health and Human Services for Friday, May 14th, 2021. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings and can also be found on phlcouncil.com. I now note that the hour has come, and will the clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that your image will be displayed on screen when you speak. Madam Clerk?
Thank you, Chairwoman. Councilman Heenan? Councilmember O?
Good morning, Chairwoman. Good morning, colleagues. Good morning, public. I am present. Thank you very much.
Morning.
Councilmember Gim?
Good morning, Madam Chair. Good morning, colleagues. I am present.
Good morning.
Councilmember Green? Councilmember Thomas?
Good morning, Madam Chair. Good morning, colleagues. I'm present.
Good morning.
Councilmember Brooks?
Good morning, Madam Chair. Good morning, colleagues. I'm present.
Good morning.
And Chair Bass?
Thank you very much. I am present. A quorum of the committee is present, and this hearing is now called to order. And again, this is the public hearing of the Committee on Public Health and Human Services regarding ordinance number 210331. Madam Clerk, will you please read the title of the bill?
Bill 210331, an ordinance amending Title VI of the Philadelphia Code, the Health Code, to add a section establishing reporting and employment requirements related to the changing in ownership or of the license holder of long-term care facilities and hospitals, all under certain terms and conditions.
Thank you. Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy by continuing to be in the meeting. You are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Before I call on the clerk to call the first panel, would any of my colleagues, especially the bill's sponsor, like to make any opening comments?
Madam Chair, may I be recognized?
Absolutely. Chair recognizes Councilmember Thomas.
Thank you, Madam Chair. I want to first and foremost say thank you to you and your entire team for putting us in a position to be able to have this committee hearing today on what I personally feel like is an important piece of legislation. We talked often last year about the importance of healthcare workers and the heroes that they are. And yes. Often, as council members, one of the things that people told us was to put our money where our mouth is. There's one thing to say that they're heroes and give them stickers and pizza. There's another thing to move legislation and make laws that protect the people who protected us while we were in the middle of this coronavirus pandemic. And so the legislation today It's not just about the rally we had yesterday outside of Hahnemann Hospital or other closures we've seen. It's about protecting workers. It's about protecting people who use these facilities, whether it be parents, children, community members. It's about protecting our city. As a city, we talk about being a city of eds, meds, and beds, and how much we rely on the eds, meds, and beds. And as we think about this recovery process, as we think about what things will look like on the other side, it's imperative that we protect those same eds, meds, and beds that make us the great city that we are. And so here today, we're looking at the meds. We're looking to protect that industry. We're looking to protect those folks. And we want to see as much transparency and preparation as possible whenever we see the closing of a healthcare facility. So I want to say thank you again to you, Madam Chair. I want to thank my colleagues, Councilmember Gim and thank Councilmember Gilmore Richardson for joining me yesterday at a rally with a bunch of healthcare workers who talked to us about the importance of this legislation. And I also want to thank Council Members O'Neill, Council Members Heenan, Council Members Brooks, and Council Member Gaudier for their co-sponsorship for this legislation. Thank you, Madam Chair. I appreciate the time.
Well, I want to thank you as well, Councilman, for all of your work on this very important piece of legislation. I think if we never knew before the importance of healthcare workers, and I think we all did, but it really never completely sunk in, I think, for a lot of people until COVID hit. And I think that that was a wake-up call that everyone received all at the same time, that, hey, we need our healthcare professionals. They are critically important to all of our well-beings, and we better do something to protect them. So I really appreciate this piece of legislation that you brought forward, Councilmember Thomas. Any additional questions before we start off? Oh, Councilwoman Gim, Chair recognizes Councilwoman Gim.
Thank you so much, Madam Chair. And I also want to thank the council sponsor for his tremendous leadership on this issue and the work that his team has put in to ensure that this is a quality bill before this committee. So in July 2019, the sudden closure of Hahnemann Hospital rocked the city. In a short 2-year time span, a California private equity venture capitalist named Joel Friedman exploited Pennsylvania's poor hospital protection laws to orchestrate a real estate plunder and drive a storied and historic hospital into the ground. This council said never again. This body has passed laws to not only alert but also engage the city whenever a hospital or major closure happens again. But this bill, by the bill sponsor, Councilmember Thomas, is the necessary companion to actually ensure that future sales or transfers of hospitals, congregate care facilities seek stability in our healthcare center and will not actually be based on mere profit and greed. Now, this bill to me is particularly necessary because, as I said, Pennsylvania's hospital regulations governing the closure, sale, and transfer of critically important institutions are extremely weak. New Jersey, for example, very closely governs the sale and transfer of hospitals because the consequences of not doing so are so significant. And we saw that in Hahnemann. In the absence of appropriate state oversight, local government plays an incredibly critical role in ensuring the protection of workers, of patients and staff, of our city, and of the healthcare industry overall. So again, I look forward to the discussion. I welcome all of the witnesses and thank them. Many of them are speaking from direct experience about what they went through during Hahnemann and in other kinds of situations, whether there are healthcare facilities or centers, congregate care facilities that have transferred, and changed hands and thrown into the lurch the lives of thousands of employees, plus patients, clients, and ultimately of the overall care of our city. This is an important place to say that we are going to do better. And that not on our watch will another terrible thing like Hahnemann happen again. Thank you very much, Madam Chair.
Thank you. Thank you for your commentary. I also want to recognize that we've been joined by our colleague Bobby Heenan this morning. And unless there's any additional comments from members of council on the committee, then we're going to go ahead and move into the hearing and call up the first panel of witnesses on bill number 210331. Madam Clerk, please call forward the first panel of witnesses.
First testifier is Rich Laser.
Okay, very good.
Good morning.
Good morning. Please state your name. Good morning, Rich. Excuse me, Deputy Mayor. Please state your name for the record and begin your testimony, please.
Good morning, Chair Bass and members of the committee. My name is Richard Laser. I am the Deputy Mayor of Labor for the City of Philadelphia, and I appear before you today testifying in support of Bill number 210331 as proposed to be amended. Bill number 210331 requires that any changes of ownership or licensing of long-term care facilities or hospitals be made public well in advance of the completion of such a transaction. Notice of intent would have to be made to the city, council, employees of the facilities, and on the websites of the entities involved. Additionally, various other pieces of information regarding these entities would also be needed to be disclosed and updated throughout the period leading up to the completion of the transfer. Lastly, this bill provides protections for employees by requiring an acquiring entity to retain workers at the same rate of pay and benefits for at least 90 days after the completion of the sale. The administration strongly supports this bill as proposed to be amended, and the Department of Labor is prepared to enforce it. I'd like to thank Councilmember Thomas for his leadership and for introducing this bill, and I look forward to answering any questions that you all may have. And again, I'd like to just say thank all the healthcare workers on this call and throughout the city because helping us get through this very trying year.
Yes.
COVID-19.
Yeah, calling it trying is an understatement. Mr. Laser, I thank you for your testimony and your support of this bill. Can you talk just briefly about can you talk about ways in which the administration will enforce, or if you have that laid out just yet, or if you're still working on it, we can circle back and get that information at a later date. But if you have thoughts or ideas in terms of how this piece of legislation is going to be enforced, because I think the enforcement is critically important. I do think in this town, and I've said it before, I'll say it again, we have a problem with enforcement. We have a lot of great laws on the books, but we don't always enforce. So how are we going to hold folks accountable on a piece of legislation like this? Can you talk about that briefly?
Yeah, so I think we will definitely promulgate the rules and regs for this. We'll follow the hotel bill like we've done, that this council has led on in past. I think one thing that we've done, and we've definitely brought on more staff under Candace Tuning in our office to do a lot of outreach. So I think when the city's put on notice and that there's going to be a change, we will make sure that this information gets to the employees of the institutions that are involved. I think with the great work of SEIU Healthcare and PASNAP, I know on the call, and other labor organizations that we work with, I think information is key. So I think people knowing their rights is important. So I think us getting out that information ahead of time is important. And just to make sure if any complaints come in that we reach out and make sure the institution is following through to keep the workers on at the same pay and benefits rates. So I think number one would be education, and also notifying when the city's notified and the health department's notifying, working out a process with health, then to make sure we follow up and get the information and put the employer on notice before any action is taken that they are required, that the new employer will be required to retain the workers for at least 90 days.
Excellent.
This is a very cut and dry piece of legislation and very cut and dry requirements. I think we would just have to push that and make sure that the employers are on notice well before the transfer.
Excellent. So, enforcement is key. Questions from members of council?
Yes,
Council?
Madam Chair. This is Councilmember Thomas.
Chair recognizes Councilman Thomas.
Thank you, Madam Chair. I just want to say briefly thank you to the administration for their partnership with this legislation. We had to work together for a significant amount of time to put together a number of different amendments over the last couple of weeks to put us in a position where we're doing the best we can to protect workers and people who are in these facilities, but at the same time, we don't want to put ourselves in a position to either A, put together legislation that's legally not enforceable, or B, like you said, Councilmember Bass, we put together these great bills but don't have the ability to enforce. So we wanted to put something together that we knew we had the ability to enforce, and we want to make sure that we do it in a way that's advantageous and protective to the people who need these facilities, which in turn impacts the entire city of Philadelphia. And again, I hate to keep bringing it up, but we've seen that with Hahnemann, the ripple effect that had on the entire city. So I just want to say thank you to Mr. Laser and everybody over there at the administration. Folks don't know the back and forth we've gone through for the last couple of weeks just to get to this point. So thank you.
Now, council member, I want to thank you and your staff as well. It was great working together, and I know we got it right.
Fantastic. I believe we've also been joined by Councilman Derek Green to the committee. Thank you, Councilman. Any additional questions from members of council? Okay, and if not, if we have Madam Clerk, please call up the next panel to testify.
Next is former hospital worker Regina Franklin.
Good morning.
Good morning. Please state your name for the record and begin your testimony.
My name is Regina Franklin. Good morning, Chair, Council Member Bass, and members of the Public Health and Human Services Committee. My name is Regina Franklin, and I am an administrative organizer at District 1199C and affiliated of the National Union of Hospital and Healthcare Employees, AFSCME, AFL-CIO. I am here today to give testimony in support of Councilmember Thomas' Transparency in Healthcare Bill 210331. Today I am speaking to you as a former hospital worker who served 29 years at Hahnemann University Hospital as an administrative assistant. In those 29 years, I witnessed Hahnemann serve a critical population of Philadelphia residents, including low-income residents and underinsurance patients. On the day that we were informed that Hahnemann was to be closing, the rug was pulled out from under the long-standing staff members and, most crucially, the patients we cared for. This meant that suddenly, patients who had relationships with the doctors at Hahnemann had only a short amount of time to quickly transition to a new doctor, all under the stress of potentially being uninsured and underinsured. Staff were told details of the closure in the smallest auditorium that they had, where there were barely enough room for us to hear details. People were standing in the hallways trying to hear what they were saying, of what the future of our jobs would be. During the final days at Hahnemann, the staff was still taking care of the patient with limited supply, including cutting towels in half and purchasing our own products, which were cups. This should never happen again in Philadelphia, but the sad truth is that it will. Nursing homes throughout the Commonwealth are being sold at an alarming rate, including facilities like Somerton Center and Powerback Nursing Home here in Philadelphia. This is dangerous. A 2021 study found that private equity-owned nursing homes had 10% higher death rates among residents. This study concluded that over a 12-year period, private equity-owned nursing homes led to 20,000 deaths. It is our job as a healthcare providers to look after the most vulnerable and ensure they are getting the best possible care there is. Putting profits over patient does not do that. It's past due for a solution to this. When Hahnemann was sold, there was a domino effect. Countless lives were changed forever right here in Center City, including nurses, doctors, and hospital staff, some who have dedicated their whole life to Hahnemann. These cells take a toll, on everyone, from the patient, especially the patients, the staff, and also the families. Everyone gets hurt when the process is not transparent. Councilmember Thomas' legislation has the power to address these structural issues during a hospital cell. We need transparent process where community members and advocates can learn about new owners and what they will provide. We need a guarantee that workers will still have employment for 3 months, even if there's a change of ownership. Otherwise, quality of care will decrease because our patients suffer when we suffer. I urge the passing of Bill 21033, and I thank you for your time and your consideration.
Well, I want to thank you, Ms. Franklin, for your testimony today and for being here with us. And, what you said rang true in so many different spaces for me. I have a friend who was a patient at Hahnemann and pregnant, very pregnant when Hahnemann closed and had to transfer to another hospital here in the city. And although, she delivered a beautiful baby boy and everything was fine, it was an incredibly stressful process for a high-risk pregnancy that you just never want to see happen. So I just thank you so much for all that you have done and for shedding light and attention to this matter. So thank you, Ms. Franklin.
And thank you for listening. Thank you.
Absolutely. Any additional questions from members of council? And if not, we'll have, Councilman Thomas, Chair recognizes you.
Thank you, Councilmember. Thank you, Madam Chair. I just wanted to briefly say thank you to Regina for her testimony today, her advocacy, and most importantly, for representing the heroes all across the city of Philadelphia who helped us get through this pandemic. So thank you. We appreciate you being here today. Thank you, Madam Chair.
Thank you, Councilman Thomas.
Thank you. Can we have our Madam Clerk please call up the next panel of witnesses?
Next is Wendell Royster, the Vice President of SEIU Healthcare PA, Nelson Jones from Dietary Somerton Center, and Becky Murphy, a St. Chris nurse.
Excellent. If we could have you start in that order, with the first speaker stating your name for the record. Mr. Royster, I believe that's you. State your name for the record and proceed with your testimony.
Yes, good morning. My name is Wendell Royster, and I'm the Vice President of SEIU Healthcare Pennsylvania. And we service 45,000 nursing home workers, hospital workers, and home health care aides across the state of Pennsylvania. And I would like to thank all of you for giving me this opportunity to speak here today on the behalf of thousands of workers, nursing home workers, and countless people who rely on the care and compassion here in the greater Philadelphia area. These people need your help. The long-term care industry in this country has failed them. It's failing all of us, and the pandemic has only made it worse. Like Hahnemann Hospital, nursing homes across all over the state of Pennsylvania has been sold off to bad actors, to investors that's focused on profits, and to negligent landlords whose sole goal is to squeeze every last dime out of the workers, out of the residents, out of their families, and out of our communities. It's a trend that is only going to continue unless we intervene. Somerton Center is a sad example of this disturbing trend. I want you to know that I take this very personally. Somerton Center holds a special place in my heart. I started off as a housekeeper 27 years ago at Somerton Center. And it was Somerton Center that I first learned that I could use my voice to create a change. I could make a change better for my coworkers and for my residents. I was at Somerton Center where I learned that the power of my union was impeccable. Now my union sisters and brothers and residents that they care for face attack after attack after attack. Somerton Center had 3 different owners in as many as 3 different years, right? And each time it was sold, workers have much of their what they fought for taken away from them. This type of ownership change is extremely disruptive to both the residents and the caregivers. and it almost leads to weakening the standards for everyone. And yet workers continue to stand up and fight for what's right. They're fighting for protection of their residents. They're fighting for each other. These workers and workers like these nursing home workers all over Philadelphia need your help. They need you to fight with them. They need you to pass this change of ownership bill. The state has failed when it comes to the oversight and enforcement of existing laws. There is a need for moving the resources and tools to investigate potential buyers and hold the operators accountable when they fail to live up to their promise of providing quality care. The lack of need for oversight and enforcement of the laws is criminal. We need more involvement from our lawmakers like yourselves. We need more transparency and effective oversight for potential buyers. Potential buyers should be investigated for financial stability and sustainable financial structures to assure continued quality care for our residents here in Philadelphia. Stakeholders, including workers, residents, their families, taxpayers, lawmakers like yourself, should have the opportunity to weigh in on potential buyers with public hearings. We need requirements for new owners to freeze the conditions on the ground and when they take control of the recent purchased homes. They should agree to maintain existing wages, benefits, and other staffing standards for a designated period of time to assure a smooth transition. What we need is more involvement of everyday level responsible leaders like yourselves. That's what this bill would provide. The Pennsylvania Department of Health will be releasing a new nursing home regulations soon, and they will hopefully include some of this language in these issues. But we can't wait on a fraction of state legislators to fix our problem here in Philadelphia. We are counting on you to live up to your faith and to your trust of your constituents, and that you have put to make sure that you put up the fight to protect them while it is needed. The time is now. Please change the ownership bill. Thank you for my time. Thank you so much.
Thank you for your testimony, and thank you for being here with us today. It's very insightful. Do we have any comments? Or actually, we're going to ask to hold comments and questions, if you will, until we get through the entire panel. So if we could have the next speaker, Nelson Jones, I believe that is, state your name for the record and begin your testimony.
Hi, my name is Nelson Jones.
Hello.
I'm a cook at Somerton Center. First of all, I'd like to say hello.
Hello.
I'm a cook at Somerton Center. I've been a cook at Somerton Center for 10 years. And this is a piggyback on what Wendell was saying, because I came right after Wendell. I came after the hard work that the workers at Somerton has done in order to secure a living wage in the contracts that they negotiated. So it was a nice place to work for about 8 years, and then we got sold. And to see the transformation in the workforce as well as with the residents. Somerton Center used to send us to serve-safe classes. They took time and patience and the effort to make sure that our benefits were secure. And this was the hard work that the union had done to provide these. The new owner, when the first one that came in, and it's been sold 3 times within the last 3 years. First thing they did, there was a concern about the working conditions or the residents. The first thing was to come in and assess what they can take out of the center. I was sitting at the negotiation tables with them, and they were just concerned about one thing: what they can eliminate. So the first one eliminated a little. Then the second one chipped away more and more at the contract. And the last people that came in, that's in now, they made it very clear. And I was, I guess, kind of impressed with that, the arrogance that they displayed. They let us know off the bat there would be no training fund. They would not participate in that program. They let us know very early in the negotiation, very clear, they would not participate in the fund for health and welfare. They would not. So that was a non-starter when we sat there. And they did it with such arrogance, as if there was nothing that could be done in order to prevent them from having their way. And I guess that's what's important about this transparency bill. Because once you sit down and talk with the owners, when you walk around Somerton now, the workers walk with their head down low. And the residents are confused. And these residents, I've been there for 10 years, so I've known these people. And the residents are confused because first and foremost, what they see is the quality of their living diminish. No supplies. I couldn't even get a COVID test because the the head nurse was doing 5 different other things. Everybody's just running around because there's not enough time to get to provide with their residents, as well as all the other different jobs that's heaped upon, and that's each and every one of us. I work in the kitchen. They cut the staff. When I first came to Somerton, it was like 10 people working. Now it's down to 3. So everybody's have to pick up the pieces, and they're constantly challenging it. They don't want to give us benefits. So it's a sorry state of affairs. And this bill will hopefully alleviate some of that pressure and some of the pain from the workers and the pressure off of the residents. So that's why I felt as if it was important that I speak to you council members this morning, because it is so important for the workers, because they're losing face. And it's all over the city. They're just demoralized. So when you're demoralized, they don't want to participate because they feel helpless. That's what it is. And feeling helpless, then they don't want to participate because they don't feel as if they have a voice. And hopefully this bill would give them a voice. It would help us because they're taking, and all these companies want to do is take. We don't have food to feed the residents. We don't have supplies. They're not sending the new employees to any kind of classes. So it's just it's chaotic. So thanks for having me speak this morning, and I appreciate it. Thank you.
Well, thank you for being here, and we're going to have questions for you and comments in just one moment, so please hang tight. If we could have the next person speak who was on this panel. I believe it was Becky Murphy.
Hello, can you hear me?
Yes, we can. Please state your name for the record and proceed with your testimony.
Hi, my name is Rebecca Murphy. I'm an emergency department nurse at St. Christopher's Hospital for Children. And I'm also the political and community outreach chair for PASNAP at our hospital union.
Good morning.
Thank you, Councilman Thomas, for sponsoring the proposed piece of legislation and for all those who sponsor it. I'm an emergency department nurse at St. Christopher's Hospital for Children, a crucial safety net hospital for the children of North Philadelphia. St. Chris has been sold twice in the last 3 years and is now up for sale again. And while Councilman Thomas's proposed bill may not have prevented any of those sales, it would have gone a long way towards preventing the swirling, corrosive uncertainties surrounding them for both the hospital staff and the community the hospital serves. The transparency and staff protections that the bill proposes are not just important on paper, they're also important in tangible, real-life ways, and that's why I'm here today to talk to you about that. 16 months ago, St. Chris was bought by Tower Health and Drexel University. On that very day the sale went through, the nurses were informed that all of our paid time off banks had been zeroed out, and management would no longer recognize our contract, that the bargaining unit had to start all over again. To recognize that the time off was taken away from all hospital employees, not just nurses. On the cusp of the COVID crisis in our area, without any warning whatsoever or time to prepare, the nurses at St. Chris had no paid time off. Nurses were on the front lines of the pandemic, and we were forced to quarantine due to the virus without pay once our earned vacation time was gone. Tower quickly slashed the staffing levels and that had been agreed in our previous contract and endangered both nursing staff and the North Philadelphia community that we serve. Safe staffing is something that we as a union and the nurses strongly believe in, and it's extremely important to prevent incidents, especially when we're caring for children. Our staff morale plummeted and our nurse retention suffered, and when that happens, so does the care and the continuity for the patients that we provide care to. A corporation's bottom line should not be more important than the needs and the stability of the caregivers and the community that we serve. That's why Councilman Thomas' proposed bill would ensure by inking transparency and protections into law. Healthcare is a public good, and Councilman Thomas' proposal is for the good of the public. It's much more than that. We need to get rid of a corporate healthcare system, and it's a necessity that we provide the best care for the children of North Philadelphia and for the staff members like me who care about them. Thank you.
Thank you so much for your testimony. I want to thank all of the panelists for being here today and for your testimony and for the work that you've done in healthcare. Rebecca Murphy, I thank you for all of the work that you've done as a mother of a child who was born a preemie, and knowing the work that hospitals like St. Chris and CHOP and Children's Hospital have they have a special place in my heart, because I know how hard you all work, and it's very, very difficult when your patient can be just so tiny and helpless and placed in your care. So I thank you so much for all that you have done on behalf of all of our children. They're all of our children. I also want to thank Ms. Jones. I also, want to recognize that it's incredibly frustrating that Nelson Jones was unable to get a COVID test because the nurse was so busy, and that puts both the patient, that puts the caregivers for the facility and the residents at an incredible amount of risk, because protocols aren't being followed, because people are doing 2, 3, 4, and 5 jobs on site. So we thank you for your work as well. And of course, with Mr. Wendell Royster for all of the work that you're doing through SEIU, which has long been, just at the forefront of caring for our workers and protecting them. We thank you as well. Councilman Thomas, I'm sorry, did you have a comment for the panel?
I think you did. You did the panel justice with your comment. I was going to chime in and do the same thing, but just in the spirit of time, I'll just say thank you and just echo your sentiments, Madam Chair. Thank you. I think you were well. And to the panel, thank you for being so brave, and thank you for your advocacy. You are our heroes. We appreciate you.
Thank you, Council Member. Chair recognizes Councilwoman Gim.
Yes, thank you so much, Madam Chair. And I also think that you summarized many of my sentiments perfectly. And just want to thank both Ms. Franklin on the first panel and this panel. The stories that you told about Hahnemann, the experiences that you've had at nursing homes and other congregate care facilities is what's driving this bill and our commitment to really see this through. So just want to express sorrow and regret that we couldn't do things better when they happened. I don't think many of us thought that it could be that brutal or that greed could do so much harm. One individual's greed could do so much harm. And we have got to rise up from this difficult space and ensure that it just doesn't happen again. But your voices are really driving all of this, and I just want to express my gratitude too. Thank you.
Thank you. And if there's, I see we also have a comment from Councilman Bobby Heenan. Councilman.
Thank you, Madam Chair, and I will be brief. I too want to thank all the panelists for their courage and bravery to come in here and tell their story and their experience. It's so sad and unfortunate, but as Council Member Helen Gim just said, this city rises in the most extreme circumstances for the betterment of the future. And I think this is a perfect example. And credit to Council Member Thomas, for taking lead in this. Council Member Thomas, thank you so much. This should never happen again. This should never be allowed to happen again. And, we've taken together, with the administration and this body and the representations of all the local unions and represented and non-represented people who've lived through this horrid experience, will be that example to others on what it's like and for people to stick together and to take policy and change it for the betterment of the city of Philadelphia and people's lives. It is a changing environment, and this is changing people's lives. So I just want to thank you all. Madam Chair, thank you so much for your commitment.
Thank you, Councilman. Thank you. Unless there are any other comments, and I don't see any in the chat, so I'm going to ask Madam Clerk to please call forward the next panel of witnesses.
Next, we have Uhuru Free Russ, a St. Chris nurse, Mr. Ira Sapp, our resident council president at Care Pavilion, and Kathy Cubitt, advocacy manager.
Okay. And if we could have folks speak in that order, if you could state your name for the record and then proceed with your testimony.
Good morning, everyone. My name is Uhura Free. That's my nickname. My name means freedom. Russ, R-U-S-S. I am a registered nurse and an emergency department nurse at St. Christopher's Hospital for Children. I am also the grievance chair for our bargaining unit, St. Christopher Nurses United for PASNAP. Again, I want to say thank you, Councilman. Everyone can hear me before I start?
Yes.
Perfect. I also want to say thank you, Councilman Thomas, for sponsoring the proposed piece of legislation, all you wonderful service leaders for sponsoring it. Like my colleague Becky Murphy, I also work in the emergency department at St. Christopher's Hospital for Children. And I'm here to speak on behalf of Councilman Thomas's proposed bill because corporations whose interests don't align with the medical needs of our community here in Philadelphia and the caregivers who serve them need the guardrails, the kind of guardrails and protections provided in this proposed bill. My colleague Becky talked about how some COVID positive St. Chris nurses had to quarantine without pay. I was one of the early ones, like right when it came down. Our PTO banks were zeroed, as she reported, on the very day Tower Health purchased the hospital. Nurses who had banked PTO time for their maternity leave were also left high and dry. The nurses were able to take time off only because our union organized and protected them by launching a GoFundMe to fundraise for them. I'm currently pregnant. St. Chris is once again for sale. And I do not want what happened to my colleagues last year happen to me or to my child. We need the transparency and insight Councilmember Thomas's bill would guarantee. St. Christopher's Hospital and our emergency department has lost 15 nurses over the last year, in large part due to the stress and uncertainty surrounding our last sale and our current situation. We are having a difficult time attracting more nurses. We are still in the middle of a pandemic. Our staff is completely in the dark about what's going to happen to St. Chris and what's going to happen to all of us. We need the knowledge, the protections, and the insight Councilmember Thomas's bill would provide. And because we need it to do our job properly, our patients, the children of Philadelphia, need it too. They more than need it. They deserve it, and so do we.
Okay. Well, thank you very much for your testimony. If we could now have the next panelist state your name for the record and proceed with your testimony.
This is Kathy Cubitt. I believe Mr. Ira Sapp was next. I just got word from our ombudsman that the internet is down in his facility. Someone's trying to connect by phone. So I think they're still trying to get connected. I know he's really looking I just spoke with him yesterday. I know he's looking forward to sharing his story, but I'll proceed and hopefully they'll have luck with the phone. So I want to thank.
And also, if not, I was going to say he can always submit his testimony in writing for the record, and we'll make sure that it gets to every member on the committee.
Oh, thank you. Thank you.
Absolutely. So hopefully he'll join us, but if not, we'll got him covered.
Thank you so much. I appreciate that, and I know he would appreciate that as well. My name is Kathy Cubitt. I'm the advocacy manager at CARI, which is the Center for Advocacy for the Rights and Interests of the Elderly. And I, too, want to thank you, Chairwoman Bass, Councilmember Thomas, and the members of the Committee on Public Health and Human Services for this opportunity to provide CARI's perspective on the impact of changes in ownership for residents living in nursing homes. CARI is a nonprofit organization dedicated to improving the quality of life for frail older adults, regardless of whether they live at home or in a facility. Since 1977, we have worked to promote their well-being, rights, and autonomy, and have had the privilege of working with many of your offices. Our CARI line responds to all inquiries, such as housing and healthcare issues. The Federal Long-Term Care Ombudsman Program advocates for long-term care consumers, through which CARI represents thousands of residents in nursing homes and other settings in different parts of Philadelphia. We appreciate City Council's interest in addressing issues related to changes in ownership of long-term care facilities. The sale of nursing facilities to investors has led to staffing cuts and other cost-saving measures, causing dramatic declines in the quality of care residents receive. When a change of ownership involves investors, the new operators often create subsidiaries with no track record to avoid scrutiny and maximize profits. For example, the real estate is often separated from the nursing home's operation, so the new owners can charge inflated lease or rental charges. Other subsidiaries may sell goods or services to the nursing home, such as management services, laundry, food, and housekeeping. This business model often leads to loss of staff and less care provided to residents. Pennsylvania's Departments of Health and Human Services are responsible for approving licensing changes when facilities are sold. Unfortunately, the process is more of a rubber stamp procedure. CARI and other advocates like Community Legal Services are involved in an advocacy campaign that is recommending that the Department of Health update its outdated nursing facility regulations and provide more due diligence before approving a license transfer. While the authority for licensing, regulations, and oversight of long-term care facilities falls on the state and federal government, this proposed bill would help bring transparency to the process in Philadelphia and hopefully prevent adverse outcomes. At the very least, the bill will help make residents, family members, and the community aware of the change in ownership. In many instances, these stakeholders do not learn about a change in ownership until after it has occurred. There are many examples of serious problems that have occurred in Philadelphia, in Pennsylvania, and throughout the nation as a result of the sale of nursing facilities to private equity companies and other investors who have little medical or long-term care experience, and whose primary goal is maximizing their profits. In 2017, Skyline Healthcare, operating in an office above a pizza shop in New Jersey, received a license in Pennsylvania to operate facilities formerly owned by the Golden Living chain. Within months, Skyline stopped paying vendors for services including housekeeping, laundry, food, and critical supplies. 14 months after the license was granted, the Department of Health installed temporary management in these facilities after Skyline financially collapsed, putting the health and safety of residents in jeopardy. Skyline wreaked havoc in its Philadelphia facilities, Stenton Care and Rehabilitation Center, which was under lease from Golden Living, and Willow Terrace, as well as many other facilities across Pennsylvania and in other states. Cary's ombudsmen have witnessed the impact of change in ownership at various facilities within our service area, including St. Monica's in South Philadelphia. In 2014, the Archdiocese of Philadelphia announced an agreement of sale with Center Management Group for 6 nursing homes and 1 assisted living facility. In Philadelphia, the sale included St. Monica's, St. John Newman, and Immaculate Mary Home. Prior to the sale, St. Monica's was considered a place to go to receive quality care. After the sale, Cary's ombudsman received complaints and observed staffing cuts and poor quality care. In addition, prior to the change in ownership at St. Monica's, there were no complaints related to illegal discharges that, for example, may occur when Medicare coverage ends. Since the sale, it has been a top complaint. The reduced staffing and other factors proved to be deadly when COVID ravaged the facility. At one point, staff were forced to wear trash bags when PPE was not available. In conclusion, residents, staff, and communities often suffer negative consequences when a change in ownership occurs at nursing homes involving investors. Residents often receive poor care due to staff reductions and other cost-cutting measures. Many residents rely on Medicaid and are particularly disadvantaged in that they essentially are not able to move to another facility, even if living conditions become untenable. And highly rated facilities tend to avoid admitting residents on Medicaid. Staff may lose their jobs or experience loss in pay, benefits, and tenure under the new management. Communities often lose a valuable resource, as when the need arises for nursing home care, people often prefer living in their own communities. A change in ownership may mean they are faced with the draconian choice of going to a poor-performing facility or moving farther away from friends and family. Cary appreciates your concern for the life, health, and well-being of long-term care residents. Please count on us on your efforts to support older Philadelphians. Thank you again for your attention to this important issue and the opportunity to testify.
Kathy, thank you so much for your testimony. I'm sorry, I'm getting feedback. Your commentary really does help us to make sure that the public knows that to keep the worker safe, keeps the patient safe, keeps everyone safe. So thank you so much for your testimony, and also to Ms. Russ, thank you for your testimony. Mr. Stapp, I'm assuming has not joined us. I have not seen that he has been able to rejoin us. So we will accept his testimony as part of the record for this hearing and make sure that, again, that it's circulated to all members of council. Are there any questions from members of council? Questions or comments? No? Okay. If we could have the clerk call forward the next panel.
Madam Chair, I just wanted to thank this panel as well, too. I'm sorry. I just wanted to thank this panel as well, too. I was having a little trouble coming off mute there for a second. We appreciate your testimony as well, and the narratives and the experiences that you shared, the ones that, really drive us to do the work that we're doing. So I just wanted to say thank you to this panel, and I know that there was a lot of passion from folks who couldn't be here. We've seen some of that energy yesterday as well, too, but if folks do submit written testimony that will be taken into the record, like our chair said. So thank you, Madam Chair, and thank you, everybody, for being here today.
Thank you, Councilman. Thank you very much for your testimony, for your commentary and support, and thank you most importantly for bringing forth this bill. Seeing that there are no other comments from members of council, Madam Clerk, are there any other witnesses to testify?
There are no additional witnesses.
Okay. There being no further questions from members of the committee and no other witnesses to testify, I will ask if there is anyone else present in this hearing whose name we have failed to call and that wishes to offer testimony on the bill or the bill being considered today. Okay, and seeing none, hearing none, I want to thank all of the panels and witnesses for your participation today. We value your opinions, and I now invite you to please disconnect from our meeting before we go into our public meeting. We will now pause the proceedings briefly as participants will leave the meeting. Thank you very much for attending and for providing your input and insight today. Thank you.
Thank you.
Thank you.
Thank you.
Welcome. Okay, this concludes the public hearing of the committee. We now go into the public meeting to consider the action to be taken on the bill before this committee today. Madam Clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that we may see your image on the screen when you speak. Madam Clerk?
Councilmember Heenan?
I am present, Madam Chair.
Councilmember O? Councilmember Gim?
Good morning still. I am present.
Councilmember Green?
All those folks
Sir President.
positively.
Councilmember Thomas?
Present.
Councilmember Brooks?
Present.
And Chair Bass.
Good morning. I am present still as well. Okay, and a quorum of committee members is present. The chair recognizes Councilmember Heenan for a motion on the amendment to Bill number 210331.
Thank you, Madam Chair. I move that the amendment to Bill number 210331, a copy of the amendment has been circulated to all members of the committee. I move for the amendment to Bill number 210331 be approved.
Second.
Thank you. And for the record, I want to note that Councilwoman Gim seconds the motion, and it's been moved and properly seconded that the amendment to Bill number 210331 be approved. All of those in favor of this motion will signify by saying aye. Aye.
Aye. Aye.
Anyone opposed? Okay, the ayes have it, and the motion to amend Bill 210331 has been approved. I want to now recognize Councilmember Heenan for a motion on Bill number 210331 as amended.
Thank you, Madam Chair. I move that Bill number 210331 as amended be reported from this committee with a favorable recommendation. I move that the rules of council be suspended to permit the first reading of this bill at our next session of council.
Second.
Chair recognizes that the motion has been seconded by Councilwoman Gim. It's been moved and properly seconded that Bill number 210331 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those who are in favor of this motion will signify by saying aye. Aye.
Aye.
Aye.
Aye.
Anyone opposed? Okay, the ayes have it. The motion carries. And this concludes the business before this committee on Public Health and Human Services today. I want to thank everyone for their attendance. Thank you, Councilmember Thomas, for this outstanding piece of legislation. And thank you very much for your attendance today. Everyone have a great weekend. Bye-bye.
Thank you, Madam Chair. Thank you, colleagues, for your support. I definitely appreciate you guys.
Thank you.